This is Dr. Van Reken at Reno MedSpa. You can watch this whole video. We show how to drain acne cysts. If you just want to see this patient's before and after pictures and how she did with the chemical peel, photodynamic therapy, and 4 different episodes of drainage, and you want to see how much better she is, you can fast forward to about the last 30 seconds or so of this video. We'll show you her before and after pictures, and you can get a drift of how effective this is. This is Dr. Van Reken at Reno MedSpa, and I have lovely Allison with me. And Allison's been our patient for some months now, and today we're going to drain some cysts and blackheads, little whiteheads on her acne. How much better are you with the various treatments you've had here since you started?
I'd say I'm at least 70% better since I started.
Okay, so you're happy.
Mm-hmm.
And as I understand it, you've done 1 chemical peel.
Yeah.
And you've done 1 photodynamic therapy where we put some chemical on and then put a red light on you.
Yeah.
How much do you think the photodynamic therapy helped you?
I think it helped probably better than anything else I did. It helped a whole lot, I'd say.
Okay. And then I have, like I'm doing today, I've poked you with a needle, a 20 gauge needle, which is not a tiny needle. It's a fairly sizable needle. It hurts a bit. And then I put an extractor on to get the contents of the zit out, if you will, the pus or the sebum, which is oil. And I've done that. Will this be 4 times today?
Yeah, I think so.
How much flatter do you think your face is if you run your finger over it compared to before?
Like 90% flatter. It's a lot.
So, and if we take a little close up here, we see a lot of this is no longer active acne, and that was pretty active and pretty hot 3-4 months ago, wasn't it?
Yeah.
With active lesions, and now she's got one here and there, and that's mostly reddish scar. We're also going to do a V-beam treatment, which is a laser treatment, good for reds, and each V-beam treatment is probably going to take out about 20 or 30% of the redness of that scar. It will also make the scar a little softer to the touch. Many scars, surgical, acne, whatever, are firm to the touch. And you see a little blood coming out, which is normal. One on the nose here. Sorry, I don't enjoy hurting you, but kind of goes with the territory. Okay. And there you can see a little bit of sebum, a little bit of oil in there. And that's come out. And you know, it doesn't seem like much, but those zits really flatten out when you take this stuff away. They really do better. You know, you can see I'm a kind of a guy, and you can see some stuff there. I like these advanced scientific words like zit. Okay. Well, I keep my prices for acne patients lower. A lot of stuff isn't covered by insurance, or at least by many insurances. Whoa. So a lot came out of that one. You know, when I see patients from other doctors, even patients with really severe acne, I seldom see that this procedure has been done. It doesn't pay real well when it's done through insurance, but it's usually covered by insurance if you are insured. And I think because it doesn't pay real well, it doesn't get done sometimes, even though it should be. And I think the patients really benefit from it. What do you think, Allison?
Yeah, I think I benefited a lot.
From the drainage,
yeah.
And you know, you can benefit in various ways. I think you make other therapies more effective too, because if you decrease the size of the comedone, or the zit, if you will, then if you're using topical therapy, which means locally applied like a cream or a gel, then topical therapy is going to get to more of that zit because it's not as big. If you're using photodynamic therapy, which we do with both chemicals and light, the penetration into the comedone or zit is greater because it's partially open. So there are many reasons. Well, there's a lot of pus on that one, and oil. You know, and I think one of the best things about drainage, in my opinion, is the flattening, because a lot of these things are raised significantly, and once you flatten them, they look better and they're easier to handle. I have my capable assistants, these sisters, Blanca and Lily, with me. They've been with me for a lot of years, and I'm blessed to have them. Have people that know you noticed a difference in how you look?
Yeah.
Who's told you stuff?
My mother-in-law, my mom, my dad.
So a lot of people say you're getting better, huh?
Yeah.
Well, that's cool because you are a lovely lady, and the only thing about you that isn't a 10 is your skin, and we're working toward that. Now, you would think that by sticking needles in people, they would scar. These are pretty small needles. It's under a millimeter, and I don't even put the whole thing in, so most of these wounds aren't even a millimeter wide. My experience is that people scar less and you prevent scarring, and the reason that they scar less is that, first of all, it's a minor wound and with a clean instrument, and secondly, once that drains, it heals in better and people just don't scar as much. You've had 3 of these before. How long did it take to look better than before I started when I did this?
Probably about 2 days actually.
So in 2 days you look the same or you look better?
Better.
And then how about in a week?
A lot better.
A lot better. Okay, just because they're drained and okay. All right, thank you, Allison. This is Dr. Reken signing out for Reno Sparks Med Spa. Stay good looking.
So if you look at these photos, we've got some right profile, some left profile, and full-on portrait of our patient here before and after acne treatment, including 4 drainages, 1 chemical peel, and 1 photodynamic therapy. I don't think I need to say much about these. You can just look at the before and after pictures and judge for yourself what kind of results you think she got. So good luck to all you acne sufferers. I suffered the same when I was young, and good luck to all of you.